In terms of whether we're doing enough, I think it really depends on the local situation. So if you're looking at countries in Europe and the United States, lockdown is a really important strategy because really that's the only thing that you've got up your sleeve in order to get on top of community transmission if you're not able to do individual case-based containment through contact tracing and isolation. But in other parts of the world, like, for example, China, parts of Asia and Australia, where we're not currently seeing huge amounts of community transmission, really the strategy has got to be much more around finding every single last case, doing the contact tracing and isolating cases. And this is where the international travel restrictions are particularly important.
Is a vaccine the solution? Because that seems to be years away.
Well, a vaccine will be ultimately the solution, yes. And there are many researchers around the world that are working to develop a whole range of different types of vaccines, and with the ultimate hope that at least one of those vaccines will emerge as an effective and safe vaccine. A vaccine is really the only way that we're going to guarantee sufficient levels of immunity in the population to prevent future resurgence of this particular pandemic.
Archie, when you talk about the lockdown being really the only way to flatten this curve, to make sure there's not too much pressure on the health system, many people we speak to will ask, what happens when the lockdown is lifted? And when you're in these countries, there's a great fear that as soon as they try to get life back to normal, that you'll see a big spike in cases. Is that your expectation?
Well, that's very much a fear. So, yes, it's really important that social distancing measures, whether they are total lockdown, as you're seeing in some parts of the world, or more measured approaches, as you're seeing in other parts of the world, it's really important that those are kept in place for long enough to ensure that the virus doesn't come back. Because what you might find is that there might be residual hotspots that have been undetected, where there might be some low-level community transmission. Then you remove the social isolation or the lockdown, and they can seed future epidemics. Or indeed, cases may be reintroduced as people travel internationally if the international travel restrictions are ever lifted. So really, yeah, those strategies have to be kept in place sufficiently long in duration to provide time for a vaccine to become available.
Hi, I'm Emily Tan, and thanks for watching CNBC. You can check out more of our videos by clicking on the boxes on the screen, and don't forget to subscribe to the channel for more. Thanks for watching.